Welcome to the Healthy You podcast from North Shore University Health System, where we explore trending topics in healthcare. I'm Carolyn Starks. There's incredible diversity of viruses in wildlife. These are like mutant germs that can jump species, for example, from bats to an intermediary host like a camel or a pangolin, and then on to humans. The latest virus to make that jump in headlines, which I'm sure you've all heard about, is the novel coronavirus, now called COVID-19. Across the globe, more than 77,000 people have been infected, and about 2,250 have died. In the United States, there are 15 cases in 7 states, but no deaths. Conversations about the virus are a daily occurrence.
So what do you think of the coronavirus?
Our producer, Jon Hillenbrand.
That's a big question.
What's your gut reaction to maybe acquiring it?
I'm not very worried. Infection control, if you take certain precautions, I think you'll be fine. Yeah.
Well, I don't think it's anything to worry about as long as you protect yourself. I feel like everybody panics whenever a new illness is around. So I'm not worried. I mean, personally, I'm not worried. It's just a matter of being mindful of if someone's sick, obviously, do the right thing, cover your mouth, wash your hands. But I don't think it's anything to panic about.
So helping us sort through the emotions that are swirling in our heads is Dr. Jennifer Grant, an infectious disease physician and Associate Medical Director of Infection Prevention and Control at North Shore University Health System. Welcome to our podcast, Dr. Grant. It's so nice to have you here.
Thank you so much for inviting me. I'm really excited to be here.
From my perspective, any virus outbreak that has caused death should make us worry. Yet, if the American public is at low risk to contract this virus, I'm wondering what should we actually be concerned about?
Yeah, I think you raise a really good point. And you're right. The average American is at exceedingly low risk of acquiring this virus. But it is a new virus that we have never seen before until the past couple months. And it does have some features about it that make it a little bit more severe than some of the viruses that we encounter in our day-to-day life, such as influenza. So this virus appears to be more contagious and is making a higher percentage of people more severely ill to the point where they might need to be ventilated with a mechanical ventilator or in the intensive care unit. And right now, we have the potential to stop this virus, to kind of squash it and get rid of it so it is not spreading everywhere in the world. And that's why we as medical professionals and public health officials are really focused on this and really trying to kind of stamp this out so it doesn't become a problem that spreads, and then we will worry about it more in our day-to-day lives.
So you mentioned severe illness. So what are people actually dying from? I'm confused about that. Is it a severe pneumonia that it shuts down their? I'm not sure.
Yeah, no, exactly. The spectrum of disease seems to be very broad. So there's people out there that probably have very minimal symptoms, runny nose, sore throat, kind of a typical cold. But the thing that we worry about most is that the virus does seem to cause more pneumonia, meaning it binds to receptors in the lungs, causes a bad inflammatory reaction in the lungs where people stop being able to process oxygen as well. So their oxygen levels can go down. They need to have these ventilators or really advanced care to keep the oxygen levels up in their bodies. And that can lead to severe illness and even death.
I will now hand things over to CDC's Director, Dr. Robert Redfield. Thank you.
Thank you, Mr. Secretary. To better protect the health of the American public during the emergence of this novel coronavirus, and based on the evolving information from China, CDC has reassessed its entry strategy and decided to expand to screening travelers from the 5 airports originally to 20 airports in the United States. My thoughts and prayers are with all.
So the CDC Director, Robert Redfield, said recently, and quote, "The spectrum of this illness is much broader than was originally presented. There's a much more asymptomatic illness, and a number of the confirmed cases actually presented with only a little sore throat. So I'm wondering, in your opinion, are we only seeing the tip of the iceberg of this illness here in the U.S.?
I don't think that's the case in the United States. You know, in the United States, we have a very good count of the people who have the illness, who are at risk of the illness. They're being watched very closely. So I don't think we're seeing that in the United States. But in China, in the epicenter of this epidemic, that is a concern. People who have more severe illness are the ones that go to the hospital, the ones that get tested, the ones that we know about, that we're counting, that we're isolating. But if there is a lot of people with these mild symptoms, they could potentially be spreading the virus and kind of fueling this epidemic further. And we might not have a great handle on those people right now. But I think it's too early to say that for sure. We don't know how contagious people are when they have mild symptoms, and we don't really know yet if they're going to be fueling this epidemic further.
This might be a good time for me to ask how it's actually spread. Is it by droplets, or do we know yet?
Yeah, most likely the primary driver is droplets. So I'm infected, I cough, I sneeze, I spew these infected particles out into the air. And somebody nearby could breathe them in and get sick. But the thing about respiratory droplets we have to remember is you can also get them on your hands and then get them in your mouth or in your nose and get sick that way. And they do land on surfaces. We don't know how long they're going to stay infected on those surfaces. So there's a little bit there that we don't really know. And then maybe there's other bodily fluids that are infected that we just also don't know about yet.
So a lot of the concern is the unknown.
Very true, yes.
So how do health officials contain the spread of a world outbreak of a virus?
It depends on the type of virus that it is and how it's spread. With COVID-19, with this virus, quarantine is kind of the main thing that we're employing. And that means we have to rapidly identify people that are infected. We have to also try to rapidly identify people that might be infected, that were exposed to that infected person, and isolate these people. If you're infected, that means you're isolated in a hospital or a medical facility and being watched very closely. If you're a contact, if you're someone who was potentially exposed to the virus, then usually there's out of the hospital type quarantine efforts to keep people from spreading. And you probably have heard of this, like 14 days. And that's because we know that the incubation period of the virus is less than that. So once you've hit 14 days and you have had no symptoms, you are not going to get sick from the virus that you might have been exposed to, and you're, free and clear to go back to your regular life.
You mentioned something earlier about it's very contagious. And I'm wondering if you know or can compare it to like the flu or SARS, MERS?
Yeah, sure. So we make a lot of comparisons to the flu because we're in the middle of the flu season, and this virus does seem to be more contagious than the flu. So there's this number that we call the reproductive number, or the R0, you might have heard in the media, and that's essentially a very complicated calculation that tells us one infected person, how many people they're likely to infect. And for the flu, that number's a little bit above 1. That's kind of the general
So one person can infect one person.
Yeah, basically, when you average it out, a little bit more than one person. So one person infects nobody, one person infects 2 people. It kind of averages out. For this COVID-19, that number seems to be within 2 to 3. 2.2 is a common number we've heard. This number will change as the epidemic evolves, but does seem to be more contagious than the flu. But other things like measles and even whooping cough have even much higher reproductive numbers than that. So measles is, maybe from 12 to 18.
Wow.
And whooping cough from like 5 to 15. So there are definitely viruses out there that are more easily spread.
Okay. So I've done a lot of interesting reading about the theories that abound about the origin of this COVID-19. And it sounds like a really great science fiction.
Yeah, no, for sure. It's going to make a great movie.
But why is it important to find the origin? Well, it won't really help with containment efforts.
Yeah, not right now. You're right. But the hope is that it might help future, epidemics. It might help scientists understand what we do to prevent this from happening again. And the most likely origin, what we think now, is that this virus has probably been circulating in bats and not making those bats sick, but then had kind of a spillover event into humans and making humans sick. So, there's scientists out there who can study these viruses in bats and what do we do to prevent these events from infecting humans, knowing what these viruses are. I think it's very important for the future.
It must be fascinating to you, just because as a layperson, it's fascinating to me to study the origin of these viruses. And it's curious that bats, which are I'm assuming, more robust, so they're able to handle these viruses and not get sick themselves or destroy their species, or?
Yeah, exactly. Bats harbor a lot of infections and a lot of viruses just based on their immune systems being different than ours. And they don't make them sick, but they can make other animals and humans sick.
I'm also interested in knowing the line of how people can get infected. So we have bats, and is it something where, so you have that intermediary host. So would a bat be like, for example, this might be crazy, but like urinating on their food or the animal's food or?
Right. There is some type of event where probably infected fluid from the bat is mixing with something that another species is getting into their system, whether it's, food, or I'm not sure exactly whether, just being in close quarters and, breathing, secretions, things like that are mixing. But yeah, it seems to be the bat then infecting an intermediate animal that then infected humans. And this has been connected to a wet market in Wuhan where this all started, but there's still a lot of research that needs to be done to kind of figure out exactly what happened.
Could you comment on whether these containment efforts plus the arrival of summer could drive COVID-19 infection rates down to zero?
That's what we're hoping. We kind of mentioned comparisons to flu. We also do compare this to SARS. The viruses are very similar. This virus, COVID-19, the technical name of the virus is actually SARS-CoV-2 because they're very similar. And we know with SARS that our containment and our quarantine efforts eventually eliminated this virus. We don't see cases of SARS anymore. And that's really what we're hoping is going to happen with COVID-19. I don't know that the weather is going to have a huge impact on that. With the flu as an endemic virus, something that we see year round, it does. Flu almost disappears in the summer. And mostly because people aren't as crowded indoors and the dry air seems to, help the transmission of the flu. But I don't know that we're going to see that as much of an impact with this. I think it's really still going to be identifying people, quarantining people as the mainstays to kind of get rid of this.
Have you heard about people saying, like, avoid Chinatown and things like that? What do you think of that?
I think it's terrible. I understand that there's threats, but I think that could lead to a whole different set of issues, just given racial and ethnic perceptions. And so I think that's a real dangerous slope to be on.
No, I actually was in Chinatown recently. And I went to all the stores, ate at the restaurants. My friend and I were not scared at all. But you could tell, there were barely any people there because of fear. But I'm not worried. Yeah.
Well, we should also talk about some misconceptions. I see on social media, Facebook or whatever, some outlandish posts about stay away from Chinatown, just stoking fear. And can you clear up some of these so people can feel safer?
No, yes, there's been a lot of stigma, a lot of misconceptions around this, but right now there's no reason to stay away from Chinatown. There's no reason to stop living your life as you normally would, going to your favorite restaurants or the establishments that you always go to for fear of coronavirus. Now, it's the flu season, so you should still be taking your normal precautions about avoiding people who are sick and washing your hands, but you're way more likely to acquire the flu than coronavirus in the United States, and I would not recommend anybody changing their behavior out of fear of this virus.
Plus, anyone coming into the United States from China, wouldn't they be...
Exactly. So there's screening protocols and quarantine protocols in place from flights coming back from China right now.
Is there anything else you'd like to add that I haven't asked?
I just want to point out that this is a respiratory virus, and we know a lot of ways to help prevent getting respiratory viruses. So washing your hands is still the mainstay. You get infected particles on your hands all throughout the day, and making sure to be very vigilant about washing your hands before you're getting your hands near your mouth is an excellent way to prevent any kind of infection. And common sense too, avoiding people who are sick. The CDC actually uses kind of 6 feet as a good ratio to try to think about staying away. And if you yourself are sick, not going to work to infect your coworkers, and, using those kind of general common sense precautions that we all think about.
Common sense. It's
Exactly.
always good to end on common sense.
Yes, thank you.
Well, thank you so much for being here, Dr. Grant. Really appreciate your expertise, and I think you shed a lot of light.
Great. I had fun. Thank you so much.
You've been listening to the Healthy You podcast from North Shore University Health System. If you want more information about COVID-19, please go to cdc.gov, where they're closely monitoring the outbreak and can give you the latest statistics. And thanks.